in final MBBS, lower motor neuron, upper motor neuron, and the examiner used to take you for a ride, and at the end, better luck next time. So anyway, all the best to all the teams. Congratulations to Dr. Gurti sir, Department of Neurology, Department of Medicine for their efforts in organizing this quiz. All the best. And on behalf of Bharati Vidyapeeth, deemed university, I welcome all of you.
I would request Dr. Supriya ma'am to felicitate Dr. Gurti sir. Sir, please.
ischemic optic neuropathy is the correct answer. This patient has, yeah, give him a chocolate. Anti-ischemic optic neuropathy, the most common optic nerve disorder in those over 50, causes sudden, usually painless, one-sided vision loss, often linked to the cardiovascular risk factors like diabetes, hypertension, and fourth question.
So it is the D.
Team D.
Team D. 56-year-old man with uncontrolled diabetes, present with 1 week of fever,
Then CT scan to rule out intracranial hemorrhage and get down to of giving IV
no
tip.
role of unnecessarily delaying the process by sending to MRI.
Okay, right. That now comes back to group A, right? Question number 6.
Question.
This patient is having transient ischemia of the left occipital cortex. A transcranial Doppler velocities in the basilar artery. The right ICA is stenotic with atherosclerotic plaque. The left ICA is stenotic with an atherosclerotic plaque. Fundoscopy reveals papilledema. So, what is the correct answer?
Sir, option number C.
The right ICA stenotic with very good, excellent answer. The patient experienced a transient monocular blindness, hemorrhasis fugax, likely due to atherosclerotic narrowing. This patient is having transient ischemic branching from ischemia of the left occipital cortex can be temporarily blocked, transcranial Doppler hemorrhasis. The condition presents as painless basilar artery loss, often described as a stenotic of a curtain moving vertically with vision, usually fully stenotic with an atherosclerotic plaque. It may signal fundoscopy reveals stroke. Edema. Question number 8 to what is the correct answer? C.
Sir, option number C.
The right ICA stenotic with very good, excellent answer. The patient experienced a transient monocular blindness, hemorrhasis fugax. Right, shall go to the audience. Is it sudden onset? Yes. Anybody? Yeah. I'm afraid there are no, yes. I'm afraid wrong. Then I think we'll stop here because. Acute obstructive hydrocephalus in which there is disturbance in the normal flow of CSF within the ventricular system and from the ventricles to the subarachnoid space. The type of edema seen in acute obstructive hydrocephalus is interstitial edema, as the CSF is forced by the hydrostatic pressure to move from the ventricular spaces to the interstitium of the parenchyma. It's also termed the transependymal edema or VOEG. Okay. Question 9 goes to D. There are no, yes, D. Yeah. I am a 62-year-old patient has then a brain we'll stop here because shown on MRI. What is true about the cerebral edema? Acute obstructive hydrocephalus in which there is disturbance in the normal flow of CSF within the ventricle. It is caused by disruption of the CSF from the ventricles to the subarachnoid space. It is due to sodium potassium ATPase edema failure. In cytotoxic edema, vasogenic edema caused by obstructive CSF is forced by the hydrostatic pressure to move from the ventricular spaces to the interstitium of the parenchyma. It's also termed the transependymal edema or VOEG. Okay. Question 9 goes to D. Yes, D. Yeah. Yes, I'm afraid 62-year-old edema is the correct answer. Then I think we'll stop here because shown on MRI. Okay. What is true about the cerebral edema? Any space of hydrocephalus in which there is disturbance in the normal that will be treated with steroids. It is caused by disruption of the CSF from the ventricles to the due to sodium potassium ATPase barrier disruption. Cytotoxic edema, vasogenic edema, blood vessels caused by obstructive CSF is forced by the hydrostatic pressure to move from the ventricular spaces to the interstitium of the parenchyma. It's also termed the transependymal edema or VOEG. Okay. Question 9 goes to D. Yes, D.
A 48-year-old
Yes,
man.
I'm afraid 62-year-old edema is the correct answer. Then I think we'll stop here because shown on MRI. Okay. What is true about the cerebral edema? Any space of hydrocephalus in which there is disturbance in the normal that will be treated with steroids. It is caused by disruption of the CSF from the ventricles. It is due to sodium potassium ATPase barrier disruption. Cytotoxic edema, vasogenic edema, blood vessels caused by obstructive CSF is forced by the hydrostatic pressure to move from the ventricular spaces to the interstitium of the parenchyma. It's also termed the transependymal edema or VOEG. Okay. Question 9 goes to D. Yes, D.
A 48-year-old
Yes,
man.
I'm afraid 62-year-old edema is the correct answer. Then I think we'll stop here because shown on MRI. Okay. What is true about the cerebral edema? Any space of hydrocephalus in which there is disturbance in the normal that will be treated with steroids. It is caused by disruption of the CSF from the ventricles to It is due to sodium potassium, hyperretinemic barrier disruption, cytotoxic edema, vasogenic edema, blood vessels, caused by obstruction is forced by the hydrostatic pressure, inflammation, from the ventricular vessel permeable to the interstitium of the parenchyma. Also termed the transependymal edema or WOJ. Okay. Question 9 goes to D. Yes, D.
A 48-year-old
Yes,
man.
a 62-year-old edema is the correct MRI. Okay, what is true about the cerebral edema? Any space of ventilation in which there is disturbance in all cerebral that will be treated with steroid. It is caused by disruption from the ventricular. It is due to sodium potassium, hyperretinemic barrier disruption, cytotoxic edema, vasogenic edema, blood vessels, caused by obstruction is forced by the hydrostatic pressure, inflammation, from the ventricular vessel permeable to the interstitium of the parenchyma. Also termed the transependymal edema or WOJ. Okay. Question 9 goes to D. Yes, D.
A 48-year-old
Yes,
man.
a 62-year-old edema is the correct MRI. Okay, what is true about
Option E.
onset as early as possible? Inflammation, although this is not needed in this case since her migraine has resolved. Preventive therapy is also recommended due to her severe frequent headaches that affect her work. Preventive medication should be chosen based on her health conditions. For example, topiramate is a suitable thing for overweight patients as it may promote weight loss. Now we go to question 12 to Team B.
Question 12. A 22-year-old overweight woman with mild asthma and recurrent constipation experiences migraine 4 days a week, lasting all day. What is the best preventive medicine to begin? Overweight, constipation. Amitriptyline, propranolol, sumatriptan, topiramate, verapamil.
Topiramate.
Oh, excellent answer.
Correct.
Answer D, topiramate is the best choice for this patient due to its appetite suppressing and weight loss effects. Patient should be aware of side effects like numbness, cognitive issues, kidney stones and rare glaucoma. Other medications, amitriptyline, beta blockers, verapamil, sumatriptan. Okay. Now it is go C. Autonomic features of lacrimation, rhinorrhea, nasal congestion seen in trigeminal autonomic cephalias are due to the activation of which nucleus? Parasympathetic outflow from the superior salivatory nucleus, sympathetic outflow from the SSN, parasympathetic outflow from the nucleus solitarius, parasympathetic outflow from the trigeminal nucleus caudalis, sympathetic outflow from the TNC, trigeminal nucleus caudalis. So what is the correct answer in this? Lacrimation, rhinorrhea, nasal congestion.
Option A.
Correct answer. Parasympathetic signals from the SSN of cranial nerve 7 activate lacrimal and nasal glands. These fibers travel via the greater superficial petrosal nerve to the sphenopalatine ganglion, then follow the maxillary nerve to the lacrimal glands. They also pass through the lesser superficial petrosal nerve to the otic ganglion. A brainstem link between TNC and SSN triggers the lacrimation autonomic reflex, causing tearing and nasal discharge in response to facial pain. If you get hit with a ball in the face, it causes lacrimation and rhinorrhea for the same reason. Next question to group D. Yeah.
Question 14. A 68-year-old man with a stage 4 renal failure is receiving erythropoietin with a target hemoglobin of 14 gram. Which is the most directly increased risk as a result of this therapy? Peripheral neuropathy, ischemic stroke, seizures, dementia, headache.
Option B, ischemic stroke.
Option
B,
what?
ischemic stroke.
B, you said? Okay, correct answer.
Yeah.
Okay, now last question of this round.
Target for erythropoietin is now 10 gram only, not 14 gram.
Okay. A 10-year-old man with prior gastric bypass has developed leg numbness and falls over 2 months along with urinary retention. Examination shows loss of vibration and position sense, mild leg weakness, brisk knee jerks, absent ankle jerks. What is the most likely diagnosis? Vitamin E deficiency, D deficiency, B6 deficiency, vitamin A deficiency, and vitamin B12 deficiency.
Sir, option E, vitamin B12 deficiency.
Very good, excellent. So absent reflexes in the ankle with UMN sign, subacute combined degeneration of the cord is the message. That brings us to the closure of the round 1. Thank you, Sinha sir. Okay, Dr. Nitin, anything you want to say?
Hello. Yeah, so nicely played by all the teams, and scores we will reveal in some time. But that was round 1. Round 1 is now finished. Now round 2 we are going to start from team B. So as the each round is going to be there, the first question will start from that team and then it is going to make a complete circle. So this time it started from team A. Next time the first question will start from the team B. So now let me tell you something about the second round. Let me tell you the rules about the second round.
The same, I opened now. Yeah, this is the second round. Isko open karo. Yeah.
Okay, so
No, the round rules. In the slide. It's not moving.
yeah. So at the end of the first round, team A is having 20 points. Team B has got all the answers correct, so there are 30 points. Team C is 10 points. Team D is 20 points. And Team E again has got all the answers correct, so it is again at 30 points. This is just the beginning. Lot of rounds to be there. The scores are going to go up and down. So Team C, there is lot of still scope, so don't get bogged down.
What is Dr. Sumit gone? Sumit, come.
So the second round, you will be you have to identify the disease linking the 2-3 images or the clues which are given on the screen. There is no MCQ. You have to answer it directly. Time is again 10 to 15 seconds max per question. Correct answer will give you now 20 marks. Incorrect answer, there is no negative marking. Again, if there is anything wrong, the question is going to be passed to the audience. This is a very interesting round. There will be 3 questions per team. So either there will be a clue or there will be image. In a clue, let me tell you that suppose if I say Farhan, Chatur and Virus or Rancho. So what will you suspect? Which movie? Very good.
We showed Sholay, sir.
So now this is a picture clue. So the answer is Sholay. So similarly, we are going to give you some clues or we are going to show you some images. You have to link them and then you have to make a diagnosis. Is it clear? Everyone, all the teams are on the same page? Chalo, so let us proceed.
So we are at the second round out of 6 rounds. The first round is over. Now the picture perfect pathologist, I have with me Dr. Sumit, who is my assistant professor in neurology in Bharati. Dr. Sumit, you will take the first, you will show the first course.
So we'll start with team B, and this is their question. After the trauma, the boy had difficulty in focusing while climbing down and develop head tilt. Name the extraocular muscle involved and which side is involved.
Superior oblique muscle. Which side? Superior oblique muscle of the same side.
Which side? Left or right?
There is no negative marking.
Right side.
I'm afraid. I'm
So
afraid.
this question goes
There
to
are only two
audience.
answers, sir. Either right. So no chocolates. It's a left trochlear nerve. The patient has a left trochlear nerve palsy, which controls the superior oblique muscle responsible for eye depression and intorsion. This nerve exits dorsally from the brainstem, crosses before innervating the opposite eye. Due to the long intracranial path, it is vulnerable to injury. Patients often experience vertical and torsional double vision worsened when looking down, such as descending stairs. Tilting the head to the opposite side of the lesion can reduce the symptoms by aligning the eye positions and improving vision. Here, trauma, right head tilt, left eye is not depressing and intorting properly. That's the explanation. The second question, Sumit. Sorry, team C.
So team C, identify the clinical phenomenon and where is the lesion.
Horner syndrome in internal carotid artery.
Very good, excellent answer. So, right Horner syndrome, underactivity of the right sympathetic. This activity impacts eyelid muscles based on lesion location. Upper eyelid is lifted by the levator palpebrae superioris and molars muscle, while the orbicularis oculi controls the closure. The patient has right-sided Horner syndrome, likely from a right ICA artery dissection, causing ptosis, mild lower eyelid elevation, meiosis, possible facial anhidrosis, and apparent endophthalmos. Third question, Sumit.
So team D, name the occluded artery responsible for the abnormality noted in the provided MRI.
Artery of Percheron.
Oh, I think good.
Congratulations.
Excellent.
Good answer.
Though it is visible, many persons may not know it. That's why it is shown. It is artery of Percheron. Bilateral thalamic infarction can result from occlusion of the artery of Percheron, a variant artery arising from the 1 PCA's P1 segment that supplies both the medial thalami. The differential diagnosis is deep vein thrombosis also causes similar ones. Question 4.
So team E, name the occluded artery responsible for the abnormality noticed in the CT scan.
Are you able to see?
Yes, sir. So posterior cerebellar artery.
Anybody?
So posterior cerebral artery.
Yes, please, come on. Yes, tell.
Left MCA, no.
No, incorrect.
Anterior cerebral artery.
Yeah, where is the lesion? Excellent answer. Give him a chocolate. Right superior cerebral artery. The infarct in the right superior cerebellar hemisphere indicates the superior cerebral artery stroke on midbrain CT. SCA supplies the upper cerebellum, including the superior vermis and peduncle. Anterior inferior cerebral artery supplies the infrolateral pons and nearby cerebellar regions. Pica supplies the lateral medulla, lower cerebellum. PCL lesions do not cause cerebellar strokes. Okay, E. And vertebral artery lesions can cause pica strokes but not SCA strokes. So that's the second. Next image goes to
Team A.
team A. Study the image.
So carefully look at the image and what is the artery occluded here?
Left internal carotid.
Anybody? Yes, audience. Audience, very important. Anybody? Oh, yes. Next. Okay, I think for want of time, right? So we say that usually whenever you see decompression, it is called malignant MCA infarct. That is M1 occlusion. Whenever decompression is seen, that is a clue here. Okay, so a catheter angiogram shows blockage in the main trunk of the left MCA with no contrast beyond the occlusion. The ICA and ACA are visible. The A1 segment runs from the ICA terminus to the anterior communicating artery. So that is the clue here. Okay. Next question. 6.
So team B, study the image, name the aneurysm responsible.
Study the image and what is the aneurysm that is responsible for this?
Charcot-Bouchard microaneurysms.
Excellent answer. Right. Deep ICH, mainly caused by hypertension, accounts for 10% of strokes and is the leading cause of death. Hypertensive ICH typically affects the deep brain regions like the putamen, thalamus, and pons due to small artery rupture. Cerebral amyloid angiopathy causes amyloid buildup in cortical vessels, leading to repeated hemorrhages. Excellent answer. We'll go on to question number 7.
Team C, study the image and give your diagnosis.
The way they are answering. At times I am amazed with the answers they give. Time up. Shall we pass on? Ajay, give them time. Just give more time. Yes, you can tell, no negative marks.
No negative marking.
Anterior cerebral artery hemorrhage.
Okay, wrong answer.
Audience,
Yes. Excellent answer. Give them chocolate. The patient has a lobar hemorrhage likely caused by amyloid angiopathy indicated by multiple microhemorrhages on MRI. Amyloid angiopathy causes amyloid buildup in brain vessels, leading to vessel weakening and repeated hemorrhages, often in older adults and linked to Alzheimer's also. This differs from hemorrhage due to hypertension or aneurysmal rupture. While anticoagulation raises the bleeding risk, the symptoms fit amyloid angiopathy better here. Next.
so question for team D, study these images and suggest your diagnosis.
There is confusion in this. There are seizures that are seen, there is headache that is seen.
And various symptoms also have been
Symptoms
explained.
are depicted in the pictures.
Temporal lobe epilepsy.
You should put everything into the picture. What do you say,
Look
judges?
also at
Shall
the
we give them a
images.
chance? You can, 1 more 5 seconds to refine your answer.
Etiology of seizures.
Okay, pass this on to the audience. Next.
No. Hypothalamic hamartoma. is-
No, it is venous infarct with hemorrhage. The patient likely has a hemorrhagic infarct due to left transverse sinus thrombosis, causing venous congestion, edema, intracranial hypertension. The symptoms, headache, neurological deficit, seizures, they're all seen there. Prothrombotic states, infections, inflammation are risk factors. Diagnosis involves the CT venogram. Treatment is with anticoagulation. And if it is venous, not arterial, other common causes like hypertension, amyloid angiopathy are unlikely in this case. Next image.
So team E, what is your diagnosis based on the images provided?
Dialysis disequilibrium syndrome.
Why are you not taking the image into consideration? Your 5 seconds.
Sir, press posterior
Excellent
reversible
answer.
encephalopathy.
The patient has press. It's a diagnosed through neuroimaging showing vasogenic edema in the posterior brain regions. Associated with factors like hypertension, renal failure, immunosuppressive drugs. Symptoms include headache, visual changes, seizures, and altered mental state. Treatment, controlling blood pressure, providing supportive care, and reducing the underlying cause or removing the trigger. Study the image now.
So team A, so what is seen here?
Subdural hemorrhage.
Subdural hematoma is the correct answer. And that bridging veins, where blood collects in the subdural space forming a crescent shape over the brain. It is caused by trauma that tears the bridging veins. Headache, altered mental status, focal neurological signs. Next.
So team B, the subject suffered an impact on head and CT scan is shown. So what is the diagnosis here?
It's a counter coup injury.
Excellent answer.
Excellent.
Sir, you are asking why am I giving tough questions? They are answering everything. The patient experiences a head trauma with both coup and contra coup injuries, including a left frontal lobe hematoma, right occipitotemporal hematoma. Cerebral contusions can cause loss of consciousness, local deficits, focal deficits, and rapid decline due to mass effect. Next.
Team C, study the images in combination and what is the diagnosis?
Which team?
C.
Subarachnoid hemorrhage.
Excellent answer. The patient has SAH likely due to ruptured aneurysm, Hunt and Hess grade 3. Main cause of non-traumatic SAH is aneurysmal bleed. Risk factors: hypertension, smoking, family history, sudden severe headache, nausea, vomiting. Primarily CT diagnosis within 48 hours, and it should be intervened as early as possible.
So question for team D, study the images and give your diagnosis.
Judges, how is the question?
Low CSF headache.
Excellent answer. No, I never knew this. Yes. Spontaneous CSF leak causing low pressure headache suggested by trauma history and positional headache. Causes include lumbar puncture, surgery, or dural tears. Right. What is the diagnosis here?
Question for team E,
Sir, internal carotid artery thrombosis leading to papilledema.
question passes to the audience.
Okay, let us give the answer. IIH. Idiopathic internal hypertension characterized by elevated cerebrospinal fluid pressure over 250 mm CSF with normal CSF composition, affects young overweight women, headache, visual disturbances, papilledema. So that what you are seeing may be associated with the stenotic segment, but it's not the thrombosis. Okay, it is transverse sinus hypoplasia.
So last question of the round for team A, types of brain insult and common EEG finding. Identify the EEG finding provided.
What are the EEG findings? It's very tough. Judges, shall we give the answer to the audience?
Medial temporal lobe epilepsy.
No. Yes, anybody? Yeah. It's a, you see, brain insult. Anybody? Okay, I think it's a tough question, so we'll give periodic lateralizing epileptiform discharges. PLEDS would be expected and also discussed subsequently also in that book. It consists of unilateral, bilateral, high amplitude, short, slow waves. Okay, so that finishes all the
Yes.
round. Second round
Thank
is
you,
over.
sir.
Thank you, Dr. Sumit. We are done with 2 rounds.
Check.
Now it's going to be the third round. So,
I,
I'll give you. This is the you're writing, no?
yes.
Let's wait.
To call the, sir, she will.
And one second. Yeah.
मैं जब बोलूँगा तभी click.
Hello?
Okay, so round 2 scoring is still going on.
It is.
Till the time the score comes, let me introduce you to the round 3. The round 3 is called as clinical conundrums. Now this is going to be an absolutely silent round. I will tell you why. Please click. So here the case scenario will be given with 2 one-liner questions. There will be no choices which will be given. The time will be 15 seconds per question. Now please try to understand this round. It is a written round. Even if you know the answer, you don't need to speak anything in the mic. Cheats will be provided to you. You have to write the answer. First, now this round is going to start with team C. Now suppose I give a question to team C. That is the original team. It is going to write the answer. After that, the quiz master will say that now the pounce window is open. You have to have a show of hands. Whichever team wants to pounce. Now see, there are 2 one-liner questions. For the team which has got the original question, like the team C, out of these 2 questions, each question is going to be 10 marks each. If they answer even one correct, they will get plus 10. If they answer both incorrect, there will be no negative mark for that team. But if you are pouncing on their question, you have to get both the answers correct. Even if your one answer is correct and one answer is incorrect, it is going to give you minus 10. If both the answers are correct, then you will also get plus 20. Even if their answer is correct, they will get plus 20, you will also get plus 20. But if their one answer is correct and your one answer is correct, they will get plus 10 and the other pouncing teams are going to get minus 10. Is the rule very, very clear to everyone? If there is any doubt, please let me know.
Bouncing team should bounce only if they are 100% sure
Of both the answers.
both answers. Even if you know a single answer, you may still end up with minus 10. Correct?
Yes, yes, sir. But then show some courage, pounce, no problem.
Pouncing means buzzer.
Pouncing is by hand, you can just show that I want to pounce.
Buzzer is there.
How do we know which hand?
All teams can pounce. See, if it is team C, all the 4 teams can pounce, no problem. It is not who is pouncing first. No, everyone is allowed to answer.
Everyone get negative marks also.
Everyone will get negative also. It is not like which the team has pounced first. All teams are allowed to pounce. All will write the answers. Because it is a writing round. It is a written round. Yes, 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 100%. So even if the team C, if it's a very easy question, team C gets plus 20, there is a chance for A, B, D and E also to score plus 20. But beware, there is also chance of U4 to get minus 10. They are immune because it is their question. Okay?
It is innovation by Dr. Nitin.
Chalo, so
2
scorers,
case scenarios
okay?
per team. 2 case
2 case scenarios per team will be given. We are going to start with team C this time. The score at the end of the second round is team A is at 20, team B is at 40 points, team C is at 40 points, team D is at 40 points, and team E is at 20 points. At the end of this, this is the second round score. So, we are not total, na? So this is this round score, right? This is not total, I know. So, okay, so can we start with the round 3, clinical conundrums? Team C, are you ready?
May I ask Dr. Prajwal to join me? Papers are not there. I give them papers first. One is enough, no? How many you require? Huh?
You can make 4 cheats out of this paper.
2 cases, no, per team. And they you can write n number of answers.
Sign group, I will need volunteers to collect the cheats and give it to the judges.
So those 2 judges will correct.
Yes. There are 2 questions. They have to write question number 1, answer. हाँ, अपने टीम का नाम ऊपर लिखो. Team C, Team B, Team D, Team A, like that you have to write. Write your team name on all the cheats whichever you are going to give, so that you don't forget it by chance, right? Ready? After you are ready, please let us know so that we can start. I'll give you 5 seconds. All are ready? Team E, Team D, Team C, Team B and Team A. Everyone ready? Great. Let us start.
Who is going to start?
Team C is going to start this round.
Is it? Okay.
Okay, so a 21-year-old man, initially treated for depression, he now shows gradual personality changes, visual hallucinations, confusion, and anterograde amnesia. And now you will see his MRI and PET scans. So the 2 questions are, one is, what is this syndrome? And the second is, what is the probable etiology?
Shall I show the...
Okay, is the question clear? Okay, 21-year-old man initially had depression. Now he's got progressive personality changes, visual hallucinations, confusion, and anterograde amnesia. Okay, should we show? All right.
Collect from them. 1 or 2 will be.
So this is part 1A, okay?
This is first question.
This is the first question. The first question, and the question is like, what is
So
this?
all the pouncing teams, if they want to pounce, you can start writing the
What
answer.
is the syndrome and probable etiology? So the rest of the teams also you can write it.
Once you open the pounce window, then you can decide whether you want to pounce or not, but you can start writing the answer.
Okay. So look at the MRI and the PET scan.
It's in front of you also. The second question?
Yeah, so now if you know what it is, then how will you treat it? So how much time do we have?
We will give them 15 seconds. After that, then we'll,
So I think
we will give them
we're done. Time is up.
Okay, so the teams which want to pounce can raise their hands. Team E is there. Any more team which wants to pounce?
So they will only
So now
pounce.
collect only from C and E.
So only if C is wrong, then they
No, no,
get.
both will get them.
Both will get
Oh,
the
okay.
marks. Okay, we'll correct later? Or now we want to
We'll
settle?
do it. We'll settle it. It will become too much. Yeah.
This is team C's answer and this is team E's answer.
Oh, judges को दे दो ना. He is doing that.
So team C has said that this is a FTD, frontotemporal dementia and donepezil. Now, before we say whether it is correct or wrong, we'll see what the pouncer said. They've said Korsakoff-Wernicke syndrome and thiamine supplementation. So I think both of you are wrong. This is a limbic encephalitis. It is an autoimmune condition, and you have to treat it with immunomodulation, like steroids, plasmapheresis. So I think C does not get any points, but
C doesn't get anything, C gets 0, but team E gets -10 for this particular question.
So here the MRI reveals hyperintensity in both mesial temporal lobes. PET shows increased fluorodeoxyglucose uptake, limbic encephalitis. Paraneoplastic limbic encephalitis impacts both temporal lobes, causing symptoms like personality changes, memory loss and seizures, supported by MRI and CSF findings. Assessing for underlying tumors and specific antibodies is crucial. Okay? Second.
Don't worry.
Team D.
Don't worry, you will get
yeah.
answers.
So a 25-year-old man, so this is for team D, right? 25-year-old man with a childhood retinal disorder causing night blindness and visual field loss. It prevented him from getting a driver's license. Now he experiences leg tingling, weakness and clumsiness. The exam shows symmetric sensory loss and weakness in lower limbs. And he has elevated phytanic acid levels, and this suggests the likely diagnosis. Right? So 24-year-old man, initial visual complaints. He had a childhood retinal disorder causing night blindness and visual field loss. And now he's experiencing tingling and weakness in his legs with clumsiness.
So the first question is likely diagnosis, right? So all teams can start writing the answers. This is the
First question.
First question is what is the diagnosis?
And second question is how will you treat this? Okay, so pounce window is open. Which team wants to pounce?
Nobody pounds.
Nobody wants to pounce on this.
Burnt fingers.
Burnt fingers. Team E.
Okay, so team D has got the question, so they have already answered. Can you please pass on the check?
It's got Refsum's disease.
Excellent answer. What did you think?
I didn't think.
He said it is pediatric specialty question.
And answer second part.
So reduction in VLCFA, very light chain fatty
Correct.
acid.
So, patient's history exam and lab suggest Refsum's disease, a genetic disorder which causes phytanic acid buildup due to a fatty acid metabolism enzyme defect. It's a peroxisomal disorder affecting fatty acid breakdown. Symptoms are retinitis pigmentosa, cardiomyopathy, skin changes, neuropathy, hearing loss, anosmia, ataxia, and overriding toes. Treatment involves low phytanic acid diet, avoiding beef, goat, lamb, dairy, certain fish, and some oils.
Very good.
Team D gets
An
plus
excellent
20. Great.
Other fatty acids, man?
Very light chain fatty.
Very light chain fatty acids. Next question.
Team E.
Yeah. A patient has experienced upper limb weakness for several months. The nerve conduction and EMG show no abnormalities. High frequency stimulation and post-exercise tests did not increase the CMAP amplitude. Low frequency nerve stimulation results are provided. What is the most probable diagnosis? Okay, so you understood the question?
Yeah, you understood?
Upper limb weakness for several months, and his routine EMG nerve conduction studies didn't show anything. You did a high frequency repetitive nerve stimulation, it didn't show any increase in the amplitude. Low frequency stimulation,
The results are
the
shown.
results are shown.
First
Yeah, so
question is,
you've seen this graph, like what is the most likely diagnosis?
So first question is, what is the most likely diagnosis of this? First one.
Yeah, and
yeah,
yeah.
Okay, so let us proceed to the
Yeah.
second question, second part of the question.
Okay.
What is the symptomatic treatment for this condition?
All teams can write.
Any pouncing? You want?
No, after this.
After this.
Okay, do we have a pouncer? Team D is going to pounce. Any other team wants to pounce? A, B, C?
Only E and D.
Only E and D are there playing this round. Team E is the home question and Team D is the pouncer.
Okay, so Team E, myasthenia gravis. That's very good. I mean, I'm really impressed that you knew that. Symptomatic treatment, you've written steroids, which is not really the correct answer. Team D has written.
He gets 10.
He gets 10. He gets 10. And you've written LEMS and it is not. It is myasthenia. But you reach the junction, the NM
So
junction.
they get one answer correct, that is
Yeah.
plus 10 for Team E and minus 10 for Team D.
Team D. Yeah. So the correct answer would be pyridostigmine. Yeah.
The symptomatic treatment, not definitive treatment.
Steroids is the immunomodulation that you do, disease
Okay.
modifying treatment.
Why we didn't ask is, there are 3 modalities. You will get confused. That's why we asked only symptomatic treatment. IVIG, steroids, plasmapheresis. So anyway, we're not going to read this.
Like now this is Team A.
Team A,
Team A.
A 55-year-old man initially had lower limb weakness that progressed to affect the distal upper and both proximal and distal lower limbs. Okay, so only initially he had lower limbs, then it went on to involve the distal upper as well as both proximal and distal lower limbs, accompanied by numbness and absent reflexes. So there are numbness as well, sensory complaints and motor complaints and absent reflexes. CSF revealed mild pleocytosis with high proteins. EMG nerve conduction of the right median nerve was performed. Okay, so this is the,
First question.
yeah.
Naru conduction study report.
What is the most likely diagnosis?
You want to go back to the story? I'll show you.
Okay.
Which one you want?
You want to know
Story?
the history again?
Yeah.
Okay, so he basically had lower limb weakness, which is both proximal and distal, and only distal upper limb weakness. And this is accompanied by numbness in the extremities and absent reflexes.
Okay, so first part of the question you can write down. Second question.
And what are the treatment modalities? Yeah,
Everyone can start writing.
I think this is one that all can pounce on.
You want to pause?
No, after this. We will ask. Okay, so can we have the pouncing teams? The original. Okay, so B, C, D, all are going to pounce on this. All are going to pounce on this question. So let us collect your sheets.
Let's see what Team A does.
Team A, Team B.
Okay, so Team A is not correct.
The original team?
The original team
the original
has
team.
written multiple sclerosis and ocrelizumab.
That is wrong.
That is wrong.
Team,
Yeah.
team B.
Team B is correct. GBS IVIG
No,
plus.
no, no. This is CID.
Ah,
Take it, we'll give.
but the duration wasn't given.
No, take it.
GBS is fine, fair enough. Yes.
This is now Team C. Again, they have written GB.
GBS IVIG plex. Yes.
Okay.
Sir, I think we'll give it.
Ah, yeah, we'll
because
give.
the
We're giving.
duration wasn't
We're giving.
mentioned,
We're
yeah.
giving. We're giving.
Everyone has written the same. D also and E also.
Yeah.
So the
GBS,
original team didn't get
IVIG. No, no,
anything.
no,
The others got all the marks. No, take it, we'll give.
But the duration wasn't given.
No, take it. Leave it.
GBS is fine, fair enough.
This is now
Very
Team
nice.
C.
So, AIDP or CIDP, symmetric sensory loss. Okay. Question 5. 2.
Team B now.
Team B. So, okay, a 62-year-old lady has painful tingling and numbness in her left thumb, index and middle fingers, mostly at night. Examination reveals normal strength and reflexes with mild sensory loss in those fingers. Okay, so this is the left thumb, index and middle fingers. Electrophysiology shows delayed median nerve sensory conduction latency. Motor studies and EMG are normal. So only some abnormalities in her sensory nerve conduction study. All right, do you need to hear the history again? We good? Okay.
The first question.
So first question is,
What is the most likely diagnosis?
what is the most, okay, which nerve is getting compressed?
Is the B, sorry. This is the
Second
first,
question.
here, what is
First
the,
question.
What is the most likely diagnosis? Which nerve is getting compressed? That's the second question.
you're ready?
This two can be bounced on.
Time.
Just let other.
Ananya has
can
to-
also answer. Okay, so the bounce window is open. Which teams want to bounce?
All
D
four.
All of
wants to
them.
bounce. E wants to bounce. C and A. All are bouncing.
All of bouncing.
Okay, so can we have your answers? First, the
Yeah.
original team answer. The team answer B.
Yeah, so it's carpal tunnel, median nerve is correct.
Correct. B gets 20.
I think all of them will. Yeah, I suppose this is, everyone should have.
Everyone has got it correct.
Yeah.
Very nice. So it's carpal tunnel syndrome. So the patient's symptoms suggest carpal tunnel syndrome resulting from median nerve compression, causes pain, numbness in the thumb, index and middle finger, often worse at night. Diagnosis like Tinel's and Fallon's test, nerve conduction studies indicating severity only. Question 6.
So this is team C.
Team C?
It again starts the second question of this round.
Yeah. A 50-year-old man has coronary stenting via femoral artery puncture. Afterwards, he developed low blood pressure, required ICU care and blood transfusion, and he experienced hip pain, thigh numbness, weak hip flexion, knee extension, and absent patella reflex. Okay, you got this history? Okay, he underwent a coronary stenting via the femoral artery. Okay, he had a femoral artery puncture. He later developed low blood pressure, required ICU care and blood transfusions, and then the neurological complaints start. He has hip pain, thigh numbness, his weakness is in the hip flexion, knee extension, and his right knee jerk is absent. Okay, the knee reflex. 3 weeks later, test showed reduced saphenous nerve function and muscle fibrillations in the iliacus and quadriceps, with no issues in the thigh adductors or lower leg muscles. So the only abnormality was in the iliacus and the quadriceps. What is the correct diagnosis? And
Shall I ask the second question
the
also?
second question, yeah, what could be the possible cause? You want to see the history again, or we? Yeah, please.
Put up the history slide. Yeah. Who wants to bounce?
Okay, so which all teams wants to bounce? The bounce window is open now.
So the original team is what?
Original team C.
Original team is team C.
Anybody bouncing?
A, B, D, E. Anyone wants to bounce?
Weakness in hip
Yeah.
flexion and knee extension, and absent knee reflex on that side.
And no involvement of adductors and
Yeah, and
leg muscles.
the saphenous nerve is involved on nerve conduction study.
So no one is bouncing, so then we can take.
You are bouncing?
All right,
He is bouncing,
yeah,
correct.
good.
Good, good.
Yeah, very nice.
They are not recognized. Okay.
Team C, you make an effort.
Make an effort,
Ah,
whatever.
you right.
Before you. So at least write something.
Doesn't matter, you
Even
write.
If you get one answer correct, you will get plus 10.
Write something.
Good.
Nothing to lose.
Submit.
Let's go with the original answer first.
Yeah.
Original team's answer.
No, it's not. The localization is not in the spinal cord.
Actually, you forgot the lower limb nerves. That's the whole problem. Huh?
She does not get any points.
Yeah.
Now the bouncer team is
Bouncer team.
team D.
See, there are two questions here. One is what is the possible diagnosis, isn't it?
So localization is
What is the
Correct.
nerve you wrote? Femoral neuropathy is correct
very
answer.
well done. Yeah, that's good.
Right. What is the possible cause? retroperitoneal hematoma.
Okay, it's not ischemia. So,
He has written ischemia to femoral nerve. No,
although that was very well done, but still, I think that's a -10.
no, retroperitoneal hematoma.
But that was a really good attempt. Huh?
Very
At
good
least you
attempt.
localize it.
Give them 10 marks.
-10.
Acha, minus. I'm sorry. I'm sorry. I want to give, but others are not agreeing. But good attempt and very well done. Give them big hand.
Okay. So, yeah. A 73-year-old man with uncontrolled diabetes experiences painless weakness in extending his left hand fingers. Okay. Forearm and wrist radial extension are intact, but wrist ulnar extension and adduction are weak. Okay, I repeat, 73-year-old man, uncontrolled diabetes. He has painless weakness in extending his left hand fingers. All right. Forearm and wrist radial extension are intact, but wrist ulnar extension and adduction are weak. He has painless supination weakness. This is getting very complicated. Huh? Painless supination weakness along with weak finger and thumb extension and thumb adduction.
Abduction.
Thumb abduction. Sensory exam, radial nerve conduction and tricep reflexes are all normal.
Now you localize. Localize. What is the most likely diagnosis?
First question.
Yes, first question.
Can you show the first question?
What is the most likely diagnosis? Huh? That is the first year.
You just remember.
Change the slide
Yeah.
once. Okay, so that is the first question.
I think we'll go back to the second question is
Second question.
name two etiologies for this condition. I think we'll give them some more time for this.
More 10 more seconds.
Yeah.
Okay, the pounce window is now open. So any team wants to pounce?
Any pouncers? Nobody pouncing?
So team D has given the answer.
Median nerve.
I'm sorry, not correct. Anything, anybody else? Yes? Huh?
Nee, see, it's the cubital. Which first you have to localize. What is the?
There is no sensory in this, only motor.
Which is the nerve? Which nerve?
What part of the plexus is involved? That is
See,
Only distal.
what is the thing? It's the wrist.
Weakness of the fingers
Finger
and
extension.
ulnar adduction and extension is weak. This is okay. Which one? Who said?
Someone said pin. Yeah.
Yes, that's correct answer. Posterior introitious nerve, that's correct answer. Madam gets one. The patient's symptoms indicate posterior introitious nerve palsy caused by diabetic mononeuropathy, nerve compression, or Parsonage-Turner syndrome, leading to weakness in wrist extension without full wrist drop. Normal proximal radial nerve function, sensory tests rule out radial neuropathy and C7 radiculopathy. Absence of pain during supination makes supinator syndrome unlikely. Very good answer, madam. Congratulations to you.
A 52-year-old woman reports right hand finger weakness. TME. Okay, 52-year-old woman reports right hand finger weakness, struggling to hold a teacup with pincer grasp, but no sensory issues. Okay, it's a pure motor thing. Exam shows weakness in distal finger flexion, that is in the second and third digits. Thumb flexion, forearm pronation when fully flexed. Okay, other muscle groups and sensations are normal. So the weakness in the distal finger flexion of the second and third digits, as well as the thumb flexion. Forearm pronation is also weak when fully flexed. What is the most likely diagnosis in this patient?
Second question, batao.
Yeah, name the two muscles involved.
We'll go about the story.
So,
The question is most likely diagnosis.
diagnosis, which are the two muscles?
Muscles which are involved.
So you can involve muscles, correct? Then get
So
marks.
I think you should be able to get this one.
At least 10 marks.
Weakness is in the distal finger flexion. DIP, second, third.
One bouncer is there.
Team C is going to bounce.
Very good.
Any other team?
Madam is also ready to answer.
Nah. It's not a. So what is the localization? Which nerve? Not entirely correct, sir.
ये किसका है? ये original है?
No, this is team C.
Team C bounce.
See,
So this is, see, you can't really call it the median nerve, no? What part of the median nerve will it be?
what is the part of median nerve that is coming out?
Pure motor.
And what relates to pincer?
Yeah.
What are the muscles? Flexor pollicis longus, flexor digitorum profundus second and third, and quadratus. Supplied by anterior introitious nerve.
So it's the
Okay.
deeper branch. Yeah?
Yes. So I wanted everybody to learn these two nerves. That's why this question was framed.
Team E, because it was their original question, and the bouncers team C get -10.
Bad luck, but you
Good
learned
try.
something.
That was a good try.
This is the posterior introitious nerve. Okay.
Anterior, yes, sir. Okay, so this is team A again.
Team A.
32-year-old man with a knife wound to the left antecubital fossa was treated for brachial artery bleeding. 8 weeks later, he has weak forearm pronation, thumb movement, finger flexion with wrist flexion causing ulnar deviation. Okay? Sensation is reduced on the thumb and the first 3 fingers. When making a fist, thumb flexion is minimal, second digit flexion is partial, and fourth and fifth digit flex normally.
Very excellent framing of question. They should know that clearly.
What is the most likely diagnosis?
I thought a lot about this.
So the injury was around the brachial artery in the antecubital fossa.
Question?
First is
Name
most likely
diagnosis and then name the 2 muscles. Yeah. Backs.
Back, huh?
Yeah, I'm here, sir.
You're here?
एक आगे बस. Yeah. We'll give them about 10 seconds more.
Who wants to bounce?
What is the next question? 2 muscles.
2 muscles.
This is team A's original question. Right? Yeah. So bouncers B, C, D, anyone wants to bounce? No bouncers? Okay, team A, your answer please.
What a Baptist hand. What's a
क्या है?
Baptist handball.
Baptist hand?
I don't know.
Yeah, no, I've never. What is a Baptist? I know what a Baptist is.
So what does it indicate? What is it?
Yeah.
What is it due to? Median nerve. I think we should give it to him. What is the likely diagnosis? I think this is a.
Baptist hand, I'm not aware.
He's checking. The other judge is checking.
If it's there, it's described, then it's, yeah.
But his answer is correct.
Answer
Why is
is
it due to? He said
Median nerve, yeah. So if you knew that. Yeah.
What are the 2 muscles he wrote?
He's written flexor digitorum profundus. That's what I don't know.
तो बेनेडिक्ट के बगल में बैप्टिस्ट लिखा है. That's what I feel. No, there is a Benedict's hand, and he must have written Baptist instead, isn't it? Or boy?
Okay, so should he's written flexor digitorum profundus.
But he showed correctly. What do you think?
But sir, Benedict would have been okay. There is no such sign as Baptist. If we give marks, it would be for a sign that is not there in the literature, sir.
Okay, the muscles, two muscles involved, he's written
You'll have to give 10 to them. Yes. 10 they can give.
10,
I wouldn't score.
two muscles, you've written FDP,
At least none of us know about this.
flexor digitorum profundus he's written. So is there something like 5 marks? I mean,
No. No. Median of the profundus half आएगा ना?
half nahi, but that's fair
Okay,
enough.
fair enough.
Distal, yeah. But the other, he's named one muscle. Okay,
Only
that's
two
fine.
muscles. What is the second muscle he wrote?
No, he's not written any. He's written only one.
So 10 marks.
Sir, but he's written only one muscle.
One muscle.
So
How do we score it?
yeah.
5 marks.
No, there's no 5 marks.
Provision from Sarkari sir for 5.
All right.
Either no marks? No. Sorry. Okay. Who is the next?
Team B. Okay. A 52-year-old man has progressive weakness over 6 months, starting with right hand coordination issues and spreading to all the limbs. He shows dysarthria, reduced gag reflex, muscle atrophy, hyperactive reflexes, ankle clonus and fasciculations with normal sensations, and there is no family history. Okay? I think relatively easier.
Doctor, I'll give the questions and again come back to the...
Yes, sir. What is the most likely diagnosis? And name one more pure motor syndrome. I think there is a
Catch. Huh?
clue in the
But if
questions.
they catch it.
Yeah. Okay, 52-year-old man. Initially he had right hand coordination issues and then he had difficulty in all extremities. Additionally, dysarthria, reduced gag, atrophy, hyperactive reflexes, ankle clonus, fasciculations. Pure motor syndrome without any family history. This, I think you guys can pounce on this as well. All are pouncing?
But only two.
Only 2 teams are pouncing.
Okay, both the questions. Name the diagnosis and alternative.
Pure motor syndrome.
Yeah, so.
Team B, the original team. Let us check their answers by the time we will collect the other.
Very good. Yeah.
Second one.
So, they've got SMA, they've written. ALS and SMA. It's perfect.
That's correct answer.
Team B has got both the answers correct, plus 20 for them. Team C is
both correct.
ALS, PLS, very good. So, you've given us a different pure motor
and
syndrome.
the same is Team D.
Oh yes, excellent. All three
Very good.
scored.
All the 3 score plus 20.
Even I would not have answered in your stage. Thank you, Dr. Praswal. So we completed 3 rounds. Another 3 rounds. First rounds now. I think we'll have Dr. Sripat Pujari joining me in this. आप round sir. So इसको ना ये करके देखो, ये करके ये ना clinical neurology cases. Neurology nexus, okay? मैं करो हाँ from this slide. Neurology nexus.
Round.
नहीं करते ना वही.
Okay, so till the time the scores are getting updated,
Yeah.
let me tell you the details of this round. Okay, so
Who's going?
will be given. The 3 questions based on that disease will be asked per team. It will be MCQ or fill in the blanks type. Now, only when the quiz master is going to open up the buzzer window, that is the time you have to press the buzzers. So before we go any ahead, let us first, everyone press their buzzers. Let team 1 press the buzzer first. Wait. Let us get the buzzers on. Wait.
How are the question?
Just tell me when the buzzers get functional, right? So first let us have a checking round. Huh? Team 1, can you please press your buzzer?
I have to press,
Okay.
right?
So once they have pressed, now other teams also try to press.
1 minute, sir.
Wait. So just try to press. So nothing is going to come. So whoever presses the buzzer first, that teams, that is 1, 2, 3, 4, 5, the number will show up. Again, reset.
I have to first press. I have to press, no, sir.
No, sir, wait.
No, I have to press, then only they can press. I have
Reset.
to.
Reset करिए सर एक बार. हाँ उधर 0 कर दीजिए फिर. Okay. Now team B, please press. Team B, please pay attention. Press. Okay. It is coming.
Here. You be
Reset.
here. You do that. Okay.
Remember reset. Team C. Okay, buzzer is working. Reset. Team D. Working. Reset. Team E. Reset. Now reset. Now I will just show you. The buzzer window is now open. Press. Okay, so team 2 pressed. Okay, so now even if you press, your number is not going to come. So you have to wait for me to announce that the buzzer window is now open, and then you have to press. If you press the buzzer prematurely, it is going to be that team will get minus marks. Correct answer plus 20, incorrect answer minus 10, premature buzzer pressing minus 10. Am I clear? The question will pass only once to the other team, only one buzzer per question is allowed. Clear? Everything
Gadkari
is
sir,
written.
one thing not clear. 3 questions, 20 marks. How do we do this?
If you ask one question, then it is going to get passed. If anyone is answering wrongly, we are going to open the buzzer window and they are going to press. So this question, each team gets a chance to score either plus 60,
Plus 60.
or if they are wrong, then they will get minus 10 also. Even the original team is going to get minus 10, so you can pass if you don't know that
So
question.
per question plus 20 or minus 10?
Plus 20 or minus 10.
Minus 10.
If attempted, if attempted and correct, it is plus 20.
Plus
If it is
60 or
incorrect,
minus
it is minus 10. Anyone who presses the buzzer and gets it wrong is going to get minus 10. Even the original team, like suppose the question is now going to start from team D. You get the first question. You will be given a disease, then you get the first question. Each question plus 20 and minus 10. If you get it correct, plus 20 for you. If you get it wrong, you will get minus 10. Any team which presses the buzzer and gives the wrong answer also gets a minus 10. If the answer is correct, then they get plus 20. There is no buzzer which is open. And they give the correct answer, get plus 20. If they get minus 10.
Marking is same for all now. The
Marking is
original
same
team
for
and
everyone.
the next team.
After the question, I will tell you which team has got which point 2 times so that everyone will know.
Sir, and the last question is, so all 3 questions initially are open to team D now?
Yes.
First.
Yes.
And then
So,
they will
yeah,
go to.
but we will go one by one. So first question to team D. Then I will say the buzzer window is now open and then they will press the buzzers. If they get it wrong, if that is right, you can just give me a gesture or something. So we will not open the buzzer window at all.
Shall we start?
Yes.
Which
2
ones?
questions, 2 diseases per team. That is 6 questions per team. Yes.
He has a doubt.
We will have a connecting means the phrase buzzer window is now open. So can we press at the word buzzer or after the word open?
Open. Buzzer window is now open. Open I say and you press.
And, shall we start? Okay.
So a 58-year-old woman with hypertension, diabetes, high cholesterol presents with sudden left side facial paralysis, including inability to close her left eye and wrinkle her forehead, along with left ear sensitivity and altered taste. What is the most likely diagnosis?
Team D, this is your question.
No.
Yeah, within 10 seconds. They have to answer it. Yes.
I am afraid.
Wrong.
Okay. So the answer is wrong. So they get minus 10, number 1. The buzzer window is now open. Team 2 has pressed.
Bell's palsy.
Correct answer.
Correct answer.
Correct answer. So plus 20 for team B. Team D, your second question, starts now.
What is the most appropriate diagnostic and or management strategy at this time? Brain MR, MRI, circle of Willis, brain CT angio, lumbar puncture, MRI of the internal auditory canal, observation.
Correct answer?
Correct.
Correct answer. So no buzzer window for anyone. Team D gets the second answer correct, so plus 20 for them.
What is Bell's phenomena, Team D? What is Bell's phenomena? Describe.
It is a descriptive answer, one liner description.
Answer in mic and clearly. I think your time is over, Team D.
So the team couldn't give it, that they are not wrong, so it is 0 for them because their time was over, so they did not get any score, neither positive nor negative in the third question. And the buzzer window is now, so team C gets minus 10. No, sorry, I am sorry. The buzzer window, ek minute, ruk, reset kar. The buzzer window is now open.
Yes?
2.
When the patient tries to close the eye, the pupil goes up. It is in the oculogyric reflex.
Pupil.
It's a protective reflex. When the person tries to close the eye, the eyeball is going to move upward and
Excellent answer.
Correct
Perfect.
answer. Why you are saying pupil? It is the whole eyeball that goes.
Right on,
So
sir.
plus 20 for team B.
So, Bell's palsy and nothing much to stay. So, we'll go on to the next question.
Goes to Team E, correct?
एक मिनट इनके 2 क्वेश्चन हो गए ना
नहीं, तीनों हो गए सर.
So now it will start from team E, correct?
Team E, you ready?
First question for you.
A 45-year-old woman, mild hypertension, experiences severe vertigo, unsteadiness, nausea, and vomiting that started this morning, worsening by neck extension. Exam shows nystagmus and nausea triggered by head movements. To determine if her vertigo is central or peripheral, what is the next evaluation step? Number 1, brain MRI to evaluate for stroke. Number 2, brain MRI to evaluate for acoustic schwannoma. Number 3, Dick-Hallpike maneuver. Number 4, avoid neck rotation and Dick-Hallpike maneuver until vertebral dissection is ruled out by neck MRI with fat sat. And number 5, Epley maneuver. What is the next evaluation step to determine if it is central or peripheral?
Sir,
Team E.
Option D, avoiding neck rotation and Dix-Hallpike maneuver until vertebral dissection is ruled out by neck MRI with fat saturation.
Okay, I am afraid team E, that is the
Wrong
answer.
That is wrong.
So minus 10 for team E, and the buzzer window is now open. Team C has pressed it now.
That's correct answer.
That's the correct
Answer C is correct, so team C gets plus 20 for this now.
Now, Team E, be ready for your second question. Which of the following is most suggestive of central vertigo? Suppression of nystagmus by visual fixation, absent nystagmus latency, preserved walking with mild unsteadiness towards one direction, horizontal nystagmus with a torsional component, unilateral decrease in hearing. Which is most suggestive of central vertigo?
So option A, suppression of nystagmus by visual fixation.
No.
I am afraid that is the wrong answer. So the buzzer window is now open. Again C has pressed.
Wrong answer.
That is again wrong, so minus 10 for them. So both get minus 10.
One more.
No, buzzer is only one.
Okay. The correct answer is absent nystagmus latency, right?
Last question for you.
Yes. What is the pathophysiology for the disease process you suspect in this patient? Vertebral artery dissection, acute pontine stroke, acute infarct of vestibular nuclei, canalilithiasis, or acoustic schwannoma? Team E.
decided not to play, so they get zero
Zero.
marks for this. And because they have decided not to play, the buzzer window is now open. And it remains open.
Yeah, that
no
is
one
D.
is taking chance. D has taken, okay.
Taken a chance.
Wrong answer.
Sorry, it's -10 for team D.
Audience?
Audience, anyone?
Yeah. Canal Itihas is correct answer. Give the chocolates. Where are chocolates are not being? Neha, you are not giving chocolates. Where is that? Where is that lady who is giving chocolates?
Where is the chocolate gas?
Okay.
Very nice. Very nice question.
So, wait.
Head movement.
Okay. Next
So
question.
that there
is-
three questions are over. So now team
A.
Now you are going to get your 3 questions.
Team A ready? A 40-year-old woman developed a sudden onset of severe headache with peak within seconds, improving within a few hours. She has nausea, vomiting, but no other neurological deficit. She reported taking amphetamines. A brain CT showed a small cortical subarachnoid hemorrhage in the right hemispherical convexity. A cerebral angiogram was obtained showing bleeding in the MCA, ACA, PCA, middle, anterior and posterior cerebral branches bilaterally, but no aneurysm, no vascular malformation. CSF did not show evidence of inflammation. Her headache persisted, but over the next few weeks, her symptoms resolved with treatment. On a follow-up CT at 3 months, she was doing well. Follow-up at 3 months, she was doing well with no recurrence. What is the probable diagnosis, team A?
We will give them some time. It's a very big question.
Yeah, big question. 20
20
25,
seconds?
Yeah.
Is there enough clues in the question?
There are, sir, but they need to absorb and analyze.
The history they want to.
पीछे जाओ सर, पीछे जाओ.
Piche. Okay, so the time is up. Do you want to answer team
Team A
A?
is 0.
They want to answer no.
They want to answer?
Ruptured aneurysm.
-10.
-10 for team A.
Huh?
Options are not given for
Not,
this.
there are no options.
No
They have to just
option.
give the diagnosis.
Okay,
You have to just give.
so because team A has answered incorrectly, the buzzer window is now open. So no takers, audience?
Yes.
Yes.
Kya?
Fibromuscular. No, I'm sorry,
No,
that's
I'm
the
sorry.
wrong answer.
RCVS is the
RCVS.
correct answer. Who said
That's the
that?
correct answer.
The neurologist cannot tell.
A big hand.
Okay.
Second question for you, team A. What is the most important differential diagnosis of a thunderclap headache?
Subarachnoid hemorrhage.
I mean, that's correct
I think
answer.
that's a correct answer. That we have
Yes.
to give. Plus
Plus
20
20
for team A. You go on with your third question. What is the differential diagnosis of the CT angiographic finding? Remember, it was bleeding and any other differential diagnosis of the same CT angiographic finding.
Can we go back to that question?
Yeah,
so
yeah, we
that
can go back, sir.
Yeah.
The fourth bullet is giving you the CT angiogram.
Bleeding in MCA, ACA and PCA branches bilateral, but no aneurysm, no vascular malformation. Let us go back to the question.
Question to
Many go on. Bas.
You want to?
Okay, team A, you
Time
want to
is
answer
over.
for this?
No,
They
they've
don't
left
want to
it.
answer.
Zero.
So now it is 0 for them. The buzzer window is now open. Team 4 has pressed.
that's wrong.
Nahi beta.
A.
So again, team D gets -10.
Anybody in the audience? No, no. Rajiv Gandhi, you're right. The bleeding is there even in fibromuscular dysplasia, but is in the neck arteries. You are seeing bleeding here in the intracranial arteries, which is a feature of
Picture of
vasculitis.
CNS vasculitis. Okay?
Vasculitis.
That's it. Right.
Team B, are you ready? Yeah. A 50-year-old man with history of recurrent ischemic strokes undergoes a cerebral angiogram which demonstrates areas of narrowing and dilatation bilaterally. A diagnosis of vasculitis of the central nervous system is considered. The first question for you now, Team B, is what is the gold standard for diagnosis of CNS vasculitis? Gold standard for CNS vasculitis. You already have the angiogram.
Yeah. Yes, team B.
MR angiogram.
I'm afraid wrong answer.
Wrong answer.
It is the
You
wrong
already
answer,
have an
minus
angiogram.
10 for team B, and now because the team B has answered incorrectly, the buzzer window is now open. Team D has pressed.
Yeah.
Excellent
Biopsy
answer.
is,
That's the perfect answer.
biopsy is the correct answer, plus 20 for team D. Please reset the buzzer.
Team B, you get your second question. State whether CSF analysis is highly sensitive or highly specific in this condition.
50-50.
Highly sensitive.
I'm afraid it's wrong, highly specific. Because CSF is a very important test in CNS vasculitis. You know.
Because this is very but obvious that if it is not highly sensitive, it is going to be highly specific.
So we cancel the question.
it is not going to be transferred to anyone by the buzzer round.
Fair
The buzzer
enough.
window is not open.
Okay. Same question, next time also, you have same problem. MRI brain is highly sensitive or highly specific?
Highly sensitive.
Highly sensitive is the correct answer. You know, anything that happens on MRI brain is sensitive. That means
Absolutely.
if it is not there, it is not there. Highly sensitive test means if it is not positive,
Yeah.
that rules out the diagnosis. So that's the answer.
It's a high power to pick up the disease. Yeah.
Yes. So
So Team C,
Team C, your question.
are
First
you
question.
ready? Yeah. A 69-year-old woman, history of hypertension, diabetes, presented with TIA, found to have atrial fibrillation. The patient declined warfarin, but would like to start on one of the non-vitamin K antagonist, oral anticoagulant. Regarding these agents, which of the following is correct?
here I changed the pattern one question that I gave multiple choice.
Yes, so sometimes it is multiple choice.
That's up
sometimes
to
it
the
is not.
Now you can read.
teacher. Dabigatran, cleaned by liver and adjustments are not required in patients with renal. Apixaban, 10A inhibitor, shown to have lower risk of intracranial hemorrhage as compared to warfarin. Rivaroxaban is a direct thrombin inhibitor administered twice daily. Dabigatran has a very short half-life with high oral availability. Direct thrombin inhibitors and factor 10A inhibitors have to be monitored by coagulation studies with an INR target of 2 to 3. Which is correct?
Out of these
Team
statements,
C, your time has started.
nowadays everybody should know all about Novax. It's important.
Yes, Team C, what is your answer? So they have chose not to answer, so they get no marks for this question. And because they chose not to answer, the buzzer window is now open. 4 is pressed.
Option B is the correct
Correct
answer.
answer. Correct. They get 20. Correct. Perfect.
So,
Team
second
C,
question.
Your second question. What is the importance of Chad's VASC score?
Sir, it helps in deciding if we want to start anticoagulation.
I
in a
think correct
patient
answer.
or not.
Correct answer.
That's
Give them
perfect
give
answer.
perfect answer.
Yeah.
Third question.
What type of embolic stroke do you encounter in patients with a small vessel, large vessel?
It will not bounce now.
Large vessel.
Excellent
Yeah,
answer.
that is a correct answer.
So all the embolic
Perfect.
strokes are large vessel occlusions, big thrombi occluding the big vessels.
So they didn't answer the first question, but they answered both the other questions correct. So plus 20 and plus 20 for them.
Perfect. Team D,
Are you ready?
get ready. A 52-year-old man, migraines, multiple mini strokes, treated with aspirin, presents with a new motor stroke. MRI reveals multiple lacunes, white matter changes, but the routine stroke tests are all negative. He has no diabetes, no hypertension, no hyperlipidemia. After being lost to follow-up, he returns 3 years later with dementia this time. His family history includes early strokes and dementia. He later dies. An autopsy is performed. Team D, brain specimen. What is the likely diagnosis?
So team D is choosing not to answer this.
You want to go
What
back?
is the likely diagnosis? Okay, you want to? Let's give a couple of seconds.
Okay, give them 10 more seconds.
Actually, the history is self-explanatory.
You don't need to look at the biopsy also in this.
Okay, go ahead now. Team D.
Okay.
Pass.
Okay, so
Theoretically,
team D
sir,
has
pass.
decided not to answer, and therefore the buzzer window is now open. One has pressed.
Cadacil.
Yeah.
Yes,
that's
answer,
a
let's
perfect
get an
answer.
Cadacil plus 20 to team A.
Yeah. Team D, you get your second question. What is the genetic association of this condition?
No,
Mike, answer in the mic.
NOS3 gene.
excellent answer.
Plus
Excellent.
20.
Correct, plus 20 for team D.
Team D, what is the characteristic MRI finding?
If you look at that image, you know that it is Cadacil.
Hyper intensity of the temporal and parietal lobe.
Excellent answer.
Yeah.
Temporal
Correct.
lobe.
Why?
So again, plus 20.
Anyway.
You should have done it, no? You know,
Team.
the interesting thing here, because a NOTCH3 gene leads to protein buildup in blood vessel walls. That's the reason that they get dementia and all that, right?
Team E, your questions.
Team E, 29-year-old woman, smoker, on oral contraceptives with a history of antiphospholipid antibodies and a recent untreated left middle ear infection, developed headache and right hemiparesis. She is later becoming comatose. An MRI is shown here. Carefully have a look at the MRI. And what is the most likely diagnosis in MRI? Have a careful look at the MRI. Yeah. They want the question? You've done it, sir. So right hemiparesis, comatose and MRI. The time is got over, sir.
The time is over. You want to answer? We will give you 5 seconds window.
Brain abscess.
Wrong answer.
It's minus 10
Minus
for team
20.
E. And
Minus
because
20.
team E has answered it incorrectly, the buzzer window is now open. One is pressed.
Venous sinus thrombosis.
Excellent
Perfect
answer.
Plus 20.
Okay.
Plus 20 for them.
Team E, be ready for your second question, which is how do you further investigate? We will show you what all has been done. How will you further investigate?
MRV.
CT, we know, or MRI. I think it's
MRI,
okay.
we know
We'll
there.
give it.
Yeah.
We'll give it because it has to.
Either. So basically you are saying venogram. So
Right.
plus 20.
Plus 20 to team E.
Take your third question now. Medical line of therapy.
Sir, anticoagulants.
Excellent answer. Right
Yeah.
on.
Plus 20
We
again.
give it.
Okay.
Team A, get ready. A 49-year-old woman suffers an acute ischemic stroke, producing significant sensory loss on the left hemibody. 3 weeks later, comes with complaints of severe painful sensation when touched superficially, as well as deep burning pain in the same region. Remember, left hemisensory stroke, and then few weeks later the patient has come back again. Which area of brain suffered ischemic event?
Thalamus.
Which thalamus?
Perfect.
Which thalamus?
Posterior ventrolateral.
Which side?
Right.
तो बताना पड़ेगा ना तुमको.
So the answer is correct. Plus 20 for team A for the first question.
Which artery is the culprit artery? Team A,
You come up to thalamus.
That's a tough one, but yes. There are 4 arteries of the thalamus.
Okay, so the time is up for
You
question
want to
number
pass?
B.
Pass.
And team A has not answered, they are going to pass the question, so they don't get any marks for this second question. And therefore, the buzzer window is now open. 2 has pressed.
Thalamo-geniculate artery branch of PCA.
You should give thalamoperforators and
I
right.
think we should give. That's good.
So plus 20 to team B.
Team A. Team A.
Third question.
Third. What are transient neurological episodes?
Called TENS.
TENS. What are these?
Anybody answering?
First, let's give them their fair
Okay,
chance.
so your time
left
is
it?
up. Do you like to answer? Would you like to answer this? No. So as they are not answering, the buzzer window is now open.
Nobody.
Remains open.
Audience.
Okay. Audience.
Nobody. See, anterior circulation you have TIAs. Similarly, in posterior circulation you got TENS. They are transient ischemic neurological episodes characterized by vertigo, episodic vertigo, ataxia, dysarthria, dysphagia. These episodes keep coming. That's called TENS. Okay. Transient neurological episodes. Okay. Next.
So now
Team B. A 58-year-old man who does not typically get headaches presents now with headache. He has a history of melanoma which had been successfully treated. His headache has been worsening over the last month and has been constant. The pain is a deep ache around the left temporal and left frontal regions. He admits to mild intermittent low-grade fever and slight weight loss. He describes one episode in which he had some trouble seeing out of the left eye. So 58, non-headachy, melanoma, now headaches, deep, low-grade fever, weight loss, and trouble seeing out of the left eye.
No. This question which I am going to show, one is not for you. The second question onwards we'll have got 3 questions. We'll have got 3 questions, right?
Okay, you ready? On further questioning, he mentions that over the last 3 weeks, experiencing a cramp in his jaw while chewing and talking. On examination, you note that he is very sensitive to touch in the left temporal and scalp regions. What is the most likely diagnosis that should be first considered?
Who is the group? Yeah, B. What do you want?
Trigeminal neuralgia.
Yeah, I'm afraid it's the wrong answer.
Wrong answer.
Wait. So minus 10 for team B. Because team B has answered it incorrectly, the buzzer window is now open.
Yes?
I think we should give it to them.
Yeah,
or-
yeah, absolutely.
Excellent.
Excellent.
Okay.
Team
Yeah.
B plus 20.
Yeah. Name 2 tests, team B. Name 2 tests to investigate. 2 tests. I want.
ESR and temporal artery biopsy.
Yes,
Given.
I think excellent answer.
Given.
Plus 20 to team B.
And team B,
That
what
was-
would be the next step? Immediately you have to do it. No, not-
Steroids. Steroids.
Excellent answer. Right, I think we.
Well. How did you happen to miss it? Yeah, go ahead. Right. C, symbiosis, ready? 62-year-old man, episodes of left side facial pain, episodes of brief, shock-like, lasting anywhere from several seconds up to a minute. They are located in the left cheek, triggered by brushing teeth, touching the area. First, what do you suspect on the basis of this history? What do you suspect?
Trigeminal neuralgia.
Yeah, I think.
Excellent, give them
Correct.
Oh,
Plus
God.
20.
Now that was a bit sad. Okay. How will you investigate?
Nerve conduction study.
I'm afraid wrong.
Wait, so
Minus 10.
minus 10 for
Minus
the second
10.
question to team C. And because team C has answered incorrectly, the buzzer window is now open. Open.
Open.
Okay, no one wants to.
Okay.
Yes.
Anybody from the audience? NCV doesn't help in pain because the nerve is structurally normal. Okay? MRI. How?
Yes.
What will you look for? Huh? Absolutely.
Why didn't you pounce?
Not correct. Okay, correct. Now, the
No,
team.
this is not the question, but you remember this. What is the first line of treatment?
No, we have to
And
give
no,
the third question.
No,
then
the
and
third question there, no? This is the question.
Okay. Symbiosis. On the basis of your choice of treatment, what adverse effect should be monitored? Especially when you start the medication. What adverse effect? That's a very bad one, that's it.
Huh?
First you have to think of the drug, then you have to think.
It can lead to electrolyte changes like hyper.
What did it say?
No, but what electrolyte?
Sodium changes.
Yeah, I'll give it.
I think
I'll
it,
give it.
hyponatremia.
Fantastic. So which drug are you thinking of?
Carbamazepine.
Okay.
Given.
So carbamazepine, hyponatremia,
given.
keep in mind.
Plus 20 team C.
So are we starting the next cycle now?
No,
I
we
think
have.
it's over.
Huh?
There are still, no? 3 questions हो गया?
नहीं, एक cycle हो गया ना?
दो हो गए दोनों हो गए
दोनों हो गए ना? Finished. Okay. Thank you.
Yes.
Thank
great,
you, Dr.
great.
Shripad. So now, Madam Sujata, will you join me for the budge round? You will come for the final round? You will come for the round?
I will.
Why not? That's what I'm saying. Come.
So till the time the things are, because it was a complicated scoring round, so till the times our scorer are scoring, let me take you to the next round. We all know this round by many names. Here we have put the name as the blitz round. Each team gets 90 seconds. In 90 seconds, they have to answer as many questions as possible. The maximum number of questions is going to be 10 per team.
You keep
So even if
one
you
team
finish
you
your
do, one
10
team I do,
questions,
so that
then
you
it
are
is
not
okay.
tired, okay?
Please, all teams, please pay attention to the rules. Maximum questions are 10, right? Team C, are you with me? Please. So, correct answer will give you 10 marks. Incorrect answer will give you -5. Unattempted or pass is going to be pass, it is going to be 0. Please remember, if you pass a particular question, you cannot come back to it. It will either be true or false, or it will be a one-liner question, depending on how the question is going to come. Total 90 seconds, so here the role of timekeeper is very, very important. As soon as we say that the time has now started, you will start the timer and exactly at 90 seconds, you will press. Whatever question was asked at the 90 second, the team will get a chance to answer that question. But if you say, suppose I say that sun rises in the east, and you say pass, and then I go another, and then you cannot come back to that question. So you have 90 seconds, maximum questions which you can attempt are 10. So accordingly we will go. So this is the 5th round. So we will start with team E now. Team E, are you ready?
Yes.
Have you understood all the rules properly?
Yes.
Any doubts or any questions? No. So
Okay.
Sir, do you want to announce?
at the end of this 3 rounds, let me tell you the scores. These are the total scores. Team A is having 130 points. Team B is leading the leaderboard with 220 points. Team C, you are at 170 points. Team D is very hot pursuit of Team B, and the Team D is at 210 points. And Team E, you know this is the make or break round. After that there is one more round and you can still pick up. Right now you are 100 points. Okay, so devise your strategy accordingly. Plus 10 and -5 for these rounds if the questions are attempted. If the question is not attempted, it is 0. But if you pass it, you cannot come back to that question. Everyone clear?
Yes.
Team E, let us start the round.
So when we say wrong, somebody has to note down.
Yes.
That you tell them.
Okay.
Because it's going to be
So
very
scorers now you have to pay close attention. Siddharth, scorers pay close attention. If they say correct, plus 10. If they say wrong, it is minus 5. So you can write it on a separate piece of paper and then you can add the final score to this round.
Before I start, I welcome Dr. Sujata from Medicine Department to join us in conducting the blitz round. Right. The question starts with which?
The team E,
Gets
your question will start as soon as the question will come on the screen. No, screen is not there. You just have to read it, or it is going to come on the screen.
there. It will be there,
It's going
but
to be there.
well, she is going to read.
Okay. So
Time
we can-
starts now.
Name the fatty layered material that surrounds and insulates some axons.
Myelin.
Name the sudden reversal
Correct or
of-
incorrect? You have to
Correct,
say.
correct.
Correct. Sir, okay. Name the sudden reversal of potential that travels along the membrane of neuron.
Depolarization, action potential.
Wrong.
Correct.
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 Name
Plus
the
10.
name the unmyelinated
CCC,
peripheral sensory
fiber
muscle.
C.
Oh, correct.
Correct. Endorphins are released into the bloodstream from what gland?
Pituitary gland.
Correct.
Correct.
Neurons containing what transmitter preferentially die in Alzheimer's patients?
Acetylcholine.
Correct.
Which autonomic division conserves energy and resources during relaxed
Parasympathetic
states?
system.
Correct.
Excellent.
Holding a thought in mind while we think about
Working
it.
memory.
Correct. Very good. Wernicke's area. Listen, Wernicke's area is important for
Comprehension.
what brain function?
What?
Comprehension.
Correct.
Language function. Okay.
Yes.
The motor cortex, basal ganglia, and cerebellum help control
90
what-
seconds are over. So
what
this question
important
they will get. This question they will get.
The motor.
The motor cortex, basal ganglia, and cerebellum help control what important function of the body?
Balance.
Movement. Zero. Okay.
Minus 5.
Right. Okay.
Minus 5.
Okay.
It
Movement.
is incorrect, na?
Right.
Minus 5 for this last one. So
Balance is cerebellum. No? Basal ganglia movement. No? Control of movement. No, balance is cerebellum, not cerebellum. Balance cerebellum. Okay. Right. So we are going to team A.
yes, but first let us see. You have scored everything. Okay, so team E, your blitz round is over. Now coming to
I'm
team
going to
A.
read now. Okay.
Team A, you are ready?
Team A ready? Shall we start?
Okay, so team A, your question starts now.
What do you call the syndrome where the airway muscles collapse
OSA.
during sleep? A diagnostic feature around the cells and synapses of neurons in Alzheimer's patients is called what?
Halo.
Okay.
Halo.
It's minus 5.
A diagnostic feature inside the cell bodies of neurons in Alzheimer's patients is called what? No, no, that is around the cells.
Different
This is
Alpha synuclein.
wrong. What is it called when the brain organizes information so that it will be a permanent memory?
Consolidation of memory.
Correct. Acetylcholine causes muscles to contract by opening.
Sodium ions.
Right. Great. Good. Duchenne muscular
X.
dystrophy is due to abnormal
X.
what chromosome? X. Right. GDNF is an acronym for what? Pass bolo.
Pass.
Dogs salivating at the sound of a dinner bell even before they see the food is called what kind of learning?
Pavlov.
Pavlov, correct classical conditioning, but we'll give it.
Give it plus 10.
Right. I think
The
we'll
time
give it
is
12.
over. The time is over, but they can get this question.
Okay.
Hippocampus.
Right. Okay.
Plus 10. Yeah, one pass and one wrong. Two wrong, two wrongs. One pass and two wrongs. Okay. 6 were correct. From 21 they will start, na?
Yeah, तो answer है ना वो तो.
They will start from 21 now, na?
No, the question is 19. Their answer ना.
Team B now will start from question number 21, right?
18 हो अभी.
18 हो गए हैं, पर अभी फिर वो 10 कैसे गिनेंगे ना उसके अंदर?
तो करो ना 19 से करेंगे.
19 से 29.
19 से 29 तक.
28 तक, 19 to 28. Okay, team B, are you ready? Should we start the clock? So your clock starts now.
During digestion, what hormone is released from the stomach to suppress hunger? It is also found in brain.
Leptin.
Wrong.
CAG is a genetic code for what amino acid?
Skip.
Magnetic resonance spectroscopy is related to MRI, but instead of examining anatomy, it examines what?
Skip.
Name the enzyme from an edible root that researchers can inject and
Skip.
be taken up by. Okay. During development, the neural tube closes at about what week?
4 weeks.
Week 3 bola hai.
Wrong. Name the receptor that glutamate and aspartate stimulate.
NMDA.
Correct.
Unlike declarative language processing, procedural knowledge
Skip.
requires what? Okay. Sonic
Hedgehog
pressure
is
is important for the development of what part of the nervous system?
Neural tube.
Tube.
spinal cord. Anyway.
Correct, correct.
Yeah, we
They
are given. Correct.
Yes, judges are giving plus 10.
How does cocaine affect synaptic transmission?
It prevents the uptake.
Yes, reuptake. Correct answer.
Correct.
Not the reactor, it is correct.
Working memory depends to
No,
a
no,
large
it's so gone. The
No, last
time
question,
is gone.
no,
Time
last-
is gone, sir.
Time is gone.
Time is gone.
Okay.
So from question 29, we have to start now for team
28, no, 28.
28 they are seen already, they have seen.
No, but the
Everyone
answer
is
is not
seen.
seen, no?
No, but they have seen.
Take it, take it. Okay, okay.
So team C, are you ready?
Team C are ready.
Okay, so team C, time starts now.
Aspirin prevents pain by preventing the production of what chemicals?
Pass.
Prostaglandins. The surgical destruction of what two parts of the basal ganglia can reduce the symptoms of Parkinson's disease?
Subthalamus and thalamus.
And subthalamus and pallidum, but what do you want, judges? Give. On a daily basis, when do cortisol levels peak in the body?
Early morning.
Excellent. Name the source of the input that goes directly into the suprachiasmatic nucleus and can reset the circadian clock.
Pass.
Retina. During development, a primitive forebrain can be recognized by what week?
Pass.
When do neurons carrying touch information synapse after passing through the spinal cord? Where do the neurons carrying touch information synapse after passing through the spinal cord?
Dorsal root. The root touch or fine touch.
Anything.
After two spinal segments. Root touch.
No, that's wrong. That's wrong because neurons touch, right.
Time is over. Okay, team D, are you ready?
Yes, sir. इनका स्कोर बता दो.
D passes.
ठीक है, okay.
Okay, team D, are you ready? Team D is ready. Score. Timekeeper, please note. Timekeeper,
Can we start?
please note the time for time D starts now.
What do you call transient attack of paralysis while awake that can be triggered by emotional experiences?
Pass.
Cataplexy.
Name the syndrome where the switching mechanism for REM sleep does not work properly. Do you want to pass?
Pass.
Narcolepsy.
Name the device that monitors the electrical activity in the brain.
EEG.
Correct.
Correct.
A 30.
Fuji sign.
Pneumotocele.
Pneumocephalus. Fuji sign.
Right. Which?
This question we will give it to them. This
Right.
question we will give.
Okay. Which cranial nerve is involved in this? Through which opening does that nerve enter the orbit?
Supraorbital fissure.
Right.
Someone answered it.
Correct.
Correct. Okay. Right.
Pneumatocele वाला mark दिया है क्या? Pneumatocele was correct.
No, it's wrong. He didn't say. आपने क्या बोला? क्या क्या? Fujisen, अच्छा अच्छा, okay okay.
They are given.
हाँ,
They
okay,
are given.
हाँ,
Yes.
हो गया अभी है.
Any negative? No negative. And 2 you passed and you got only this much questions. 3 passed. Yeah.
Finished,
That's
no?
correct. Okay, so that finishes this round. The blitz round is
We are going
over.
to the last round now, and Dr. Nitin.
So till the
joined.
time
Thank
the
you very much,
scorers
ma'am.
are again going over there, let me explain the last round to you. Now we all know that gambling is a sin. But without gambling you cannot get good points. So the last round is called as gamble for glory. There will be 4 questions per team. Now this round is again going to start from team A. So there will be 4 questions. The first question you will get plus 10 and there will be no negative marking. So it will be on the house. In the gambling terms it is called as the first question will be on the house. So first question you should definitely attempt. If you are wrong, still you proceed to the second question. You have to read the question and then you can decide whether you want to play or not. If you decide to play, the second question will be plus 20 and minus 10 if it is wrong. Again, even if it is wrong, you proceed to the third question. Again, after reading the third question stem, you can decide whether you want to play or whether you want to quit. If you play, it will be plus 30 and minus 15. And the same for fourth question, plus 20 and minus, plus 40 and minus 20. That is going to be the mark scheming. Now, if after seeing second or third question, if you decide that I want to quit, I don't want to play any further, then the round immediately stops for you and you will not get the further questions. Even if you are wrong, you automatically progress to the next round. So that is the gambling over here. Are the rules clear, everyone? You can pass the question after seeing, that means you are just admitting that you don't want to play any further. No, you cannot attempt the next question then. To attempt the next question, you have to give a commitment. Your answer can be right or it can be wrong. So that is the gamble over here.
Sir, if he stops at third, he doesn't get the fourth.
He doesn't get the fourth one.
And
So
he
it is
gets
like you are sitting on the table, you say that okay, I pack, I fold.
You lost
No problem.
everything.
So at the end of the fifth round, let me again tell you the scores. Team A is at 180 points. Team B 240 points. Team C 185 points. And Team D has really scored very much in this and they are now at 270 points. Team E, fantastic scoring in this round and now you are at 175 points.
So there is a scope for improvement now.
So now everyone knows their score and now you have to gamble based on your strategy. Whether you really want to gamble or you want to pass, you will get to see the stem of the question. That is the scenario. After that, if you say I want to play, then only the question will be demonstrated to you. It is non-passable question to other teams. So please concentrate on your own questions. Time for each question will be around 15 seconds. Okay. First one is on the house. So you have to play. You should play. Okay.
10 marks the
There
pocket
is no
number.
negative mark for first. So don't quit till you see the stem of the second question. That is the only hint which I can give from here.
These are progressively difficult questions. That's right.
Yes.
We attempt the first question. If it's correct, we get 10 points. Second, 20. And if on seeing the third
He has that.
Then your progress stops over there. That will be your final score. Why 30? Yes. First and second, yes. 10 and 20 you will get. Yes, 100%. See, you can decide to quit the table anytime. When you have won, you think that I have won enough, You leave the table. It's as simple
वो
as that.
बूटी
It is
लेके चले
gamble.
जाओ. Okay. So, welcome Dr. Nitin Gadkari to join me in the final round of 16 questions. Right? Each team has got 4
Each team has got 4, so 20 questions.
20 questions, right. So, you start with the first stem.
First stem. Question is, which cranial nerve innervates the chemoreceptors and baroreceptors of the carotid body?
Vegas.
I'm afraid that is not the correct answer, but they don't get any negative in that. Again, options will be displayed. Even from the second question, the options will be displayed if you want to play the question. Again, we will give this question to them. All are MCQs.
No, MCQ. No. This is option given.
This is the question, the option is given.
So you can.
But you have answered Vegas.
You're
so
all
Vegas is wrong.
So next.
But you don't get any negative. So now you are in second question. So you can see the stem of the second question.
Hey, second question.
This is the second question. Now after seeing the second question is, patient with bilateral posterior cerebral artery strokes cannot see, but it denies it. What is the name of the syndrome? Do you like to play this round?
Play.
Okay, so plus 20 if you get it right, minus 10 if you get it wrong. Can we get the other click? Okay,
Anton
so
syndrome.
Hmm?
Anton.
Anton syndrome is the correct answer.
Correct answer. So plus 20.
Third question, stem.
Third question, stem.
Gadkari sir, just 1 second. So first they get the question, then they decide to play, and then
Then they get the answers. Yes. So question number 3, 20-year-old tall, thin man with intellectual disability and myopia presents with a stroke. Serum and urine amino acid test confirm the diagnosis. What is the condition? Question number 3, do you want to play team A for plus 30 points?
Play.
You want
Okay.
to play? Okay, so let us give them the options. Since you decided to play, you have to give me one answer.
now if he passes, he still gets minus.
Yes.
B.
Yes?
B.
B. Bombay.
Yeah.
Mitochondrial cytopathy and coenzyme Q.
Wrong answer.
That is the wrong answer. So minus 15 now. You have progressed to round 4 and you can see the stem of the question number 4.
The answer is C, by the way.
Okay, so 9-year-old girl presents with attention deficit hyperactivity disorder. On examination, she has macrocephaly, 10 hyperpigmented macules measuring more than 5 mm and a tibia deformity. Which of the following is least likely to occur in this condition? This is the stem of the question for 40 marks. Do you want to play? You have nothing to lose. Please play. C. The dealer will also always encourage you to play and gamble. You want to play or quit?
Play.
Play.
Okay.
For plus 40 and minus 20 they are playing. So,
Shall I show?
Yes sir, options please.
Renal artery stenosis, pulmonary lymphangiomatosis, optic nerve glioma, iris hematoma, axillary fracking.
Least likely. The question is least likely. Okay, so time is up. So even if you don't answer, it is minus 20. Okay, anyone
B.
from the audience
B.
wants to answer? Yes.
B is correct. B is correct answer.
B.
B is correct answer. Pulmonary lymphangiomatosis. Very.
So plus 40. So your gamble paid off. So team A.
Okay,
Finish.
finished.
Let us start with team B now. Team B, first question is, what is normal intracranial pressure? Sir, can we get the options?
Yeah, play. The first question displays.
Display. 20, 25, 30 or 15? Very close to each other.
B 25.
Wrong answer.
That is unfortunately not correct, but no negative marks. This was the first. We are trying to hook them in the game. So question number 2 for you. Mutism, lack of emotion and minimal movement may indicate an injury to which region of the brain? Do you want to play team B? for plus 20?
Yes.
Yeah, they want to play. Options, please. So is it the dorsolateral frontal region? Is it the orbital frontal region? Is it the superior mesial frontal lobe, or is it the inferior temporal lobe?
C.
They have given the answer as C. C is the wrong answer, I'm
Dorsolateral
afraid.
frontal
Minus 10 marks for team B now. Okay.
Shall I?
Anyone in the audience wants to answer? Yes?
Yeah, dorsolateral frontal region.
Yes, correct. A answer is correct.
A chocolate.
Okay.
Where is chocolate lead? Where is
Sir,
she?
Stem of the third question, stem only. Okay, 60-year-old college professor started showing abnormal rolling of eyeballs on being asked questions and started yelling lewd comments on students. She was known to be a quiet person and well behaved. In OPD, she was found to be chewing on a pen. Which of the following is more likely to be a diagnosis for plus 30? Do you want to play this question, team B?
Play.
Play.
You want to play? Okay, options please. Is it Alzheimer's? Is it
Creutzfeldt
CJD?
Jakob,
Is it
frontotemporal dementia, and progressive supranuclear palsy last.
C. Frontotemporal dementia.
Correct answer.
Correct answer, plus 30 for them. So that takes us to their question number 4, the stem. 32-year-old female patient presents with vision impairment, hearing loss, headache. The MRI demonstrates lesions in the middle of the corpus callosum. She also has lacunar infarcts. Branch retinal artery occlusions are seen with retinal fluorescein angiography. What is the most likely diagnosis? For plus 40 marks, do you want to play team B?
It is a tough question.
Plus 40 are there, see. The devil is enticing now.
You play only if you are sure. Like kaun
It
banega
is plus
crorepati
40.
rahe.
I am not saying it is minus 20 also. Huh? It is plus 40. Concentrate on winning.
Play.
You want to play?
You want to play, very good.
Cadasseal, multiple sclerosis, neurosarcoidosis, Whipple-Susac. Gamble hai.
Okay, so time is up. You want to answer this?
C. Neurosarcoidosis.
I'm sorry, it's a Susac syndrome.
So minus 20. So you are doing very well. I think one of the judges advised you not to play, but it's okay. That is what gambling is all about. If you would have won it, it was plus 40.
Asha, I think I did a wrong answer for them. We have to give it to him. That is the frontal lobe, it is superior mesial frontal lobe. That the frontal dorsal, it's not dorsolateral, it is mesial because it is that I said wrongly. That's correct answer. They said correctly. Yeah, they said correctly. Yeah, 10 marks.
Plus 10 wala na?
10,
Plus 10.
Second question.
Second question. Plus, we will go back.
Second question. This second question. They said correctly. Right. Yeah. Okay. I'm sorry about it. And take back the chocolate. I'm sorry. Team C.
Okay, Team C.
Are you okay?
Team C, ready? The first question is on electroencephalogram. What is alpha frequency? And this week, please show the options, sir. So what is alpha frequency? Is it 3 to 5? Is it 9 to 12? Is it 5 to 8? Or is it 12 to 30?
B.
B
Correct
is 9
answer.
to 12. That is correct answer. Plus 10 for them. The stem of the second question, please. Which of the following anti-epileptic medication can increase absence and myoclonic seizures? Are you ready to play this question? For plus 20.
Shall I show?
Okay.
E. Carbamazepine.
Correct answer.
The answer is correct. They get plus 20 and they also get to see the stem of the third question now. 15-year-old boy presents with lancinating extremity pain which worsens in the summer season. He also complains of occasional abdominal pain. On examination, he has dark red dots near his umbilicus, on his thighs and buttocks. What is the most likely diagnosis? Do you want to play for 30 marks, plus 30? You have to make a decision.
Play.
They are going to play.
My God.
So,
Lafora disease, Fabry's, Tangier, Hartnub, Wilson's.
Fabry's disease.
Excellent answer.
correct answer, and they have gambled very wisely. So, plus 30 for them. So, the fourth stem, they are eligible for fourth stem now. A welder presents with personality changes and tremors. On examination, he has dystonia and an abnormal gait. He walks on his toes with his spine erect and his elbows flexed. MRI shows increased signal in the pallidum on T1 weighted images. What is the most likely diagnosis? For plus 40, do you want to play?
Prajwal, this team is going to be a challenge for all the neurologists, I think.
Do you want to play? Plus 40. Play, very good. We have got big gambler sitting over here. All are wanting
Sir,
to play.
minus batao na.
Minus is 20. Well,
Is it okay?
they want to play,
You
sir,
want to
for
play?
plus 40, yes.
Okay. Parkinson's disease, manganese toxicity, mercury exposure, neurodegeneration with brain iron accumulation.
D.
I'm afraid it's wrong. Manganese
Audience.
toxicity.
Audience.
So I'm sorry. I left it.
Okay, so the answer is wrong. So minus 20 for them.
These are the answers. All right.
Okay, team D, are you ready? For the first question, which is of 10 marks, which has got no negative marking, this is your question on the screen.
Which of the following gyri is primary auditory cortex? Angular, inferior temporal, middle temporal, transverse gyrus of Heschel.
D
D is
delta.
correct answer. Okay.
Correct. Question number 2 for 20 marks. Which of the following disease is associated with reduced levels of glycine in the spinal cord and is treated with benzodiazepines? For plus 20, do you want to play? Play.
Hyperclepsia, stiff person, paroxysmal kinesogenic dyskinesia, neuromyotonia.
Stiff person syndrome.
Excellent answer.
Correct answer, plus 20. So, question number 3, the stem. The child develops the disease at the age of 2 years, has severe symptoms. Father began having symptoms when he was 20 years old, and his symptoms are not severe. The child's grandfather was found to have the disease at the age of 75 years, but has very minimal symptoms. What is the term used for worsening symptoms with each generation? Do you want to play this for plus 30? Only minus 15. No, if you pass, your journey ends. You cannot see the stem of the next question. Play, they are playing.
Anticipation, expressivity, imprinting, penetrance. Excellent
That's correct
answer.
answer. So plus 30 for them.
Gamble paid.
This is called as phenomenon of anticipation. With each subsequent generation, the disease presents earlier and in a more severe form. Yes. Question number 16, the stem. This is for plus 40. 20-year-old man presents with 2-day history of headache, fever, confusion. On arrival in EMD, he had a focal seizure. CSF was done. RBC is 300, WBC 120, which is lymphocyte predominant, 85% lymphocytes. Glucose 60 mg per deciliter. Protein is 100 mg per deciliter. CSF gram stain is negative. Apart from MRI brain, which test would be helpful in diagnosing this condition? Plus 40 marks for this question. Minus is just minus 20.
The devil is out.
So you have to make a choice now whether you want to play or you want to quit.
It's not bacterial meningitis.
Okay, so last 5 seconds for you to decide. Play.
EG, SPECT, PET, MRA.
You have to give us an answer now. Time is up, you can.
Option B.
Option B, beta. That is the SPECT.
Wrong.
I'm afraid that is wrong.
We look for periodic lateralizing epileptiform abnormalities to diagnose herpes simplex encephalitis.
So minus 20. Minus 20 for this last. So now, team E, your question begins. 18-year-old boy with polycystic kidney disease presents with severe headache, vomiting, phonophobia. Which diagnosis needs to be ruled out? This is on the house plate. There are no negative marks. Is it a
Cluster headache, migraine, pituitary apoplexy, SAH. Last 3 questions of this magical quiz.
Pituitary apoplexy, C.
I'm wrong, wrong answer.
That is the wrong answer. Anyone in the audience?
Subarachnoid hemorrhage is the correct answer. Subarachnoid hemorrhage because polycystic kidney disease associated with aneurysm.
Okay, so no negative marks for them.
Next.
Second question, the stem is patient presents with pain in the buttock that radiates down to the posterior aspect of his leg to the lateral aspect of his foot. He has decreased sensation in a similar distribution. Hip extension, knee flexion, plantar flexion and toe flexion are weak and his ankle jerk is diminished. What is the diagnosis? Do you want to play it for 20 marks?
Yes, sir, play.
Yes, they want to play.
L4 radiculopathy, L5 radiculopathy, S1 radiculopathy, peroneal lesion.
Sir, option B, L5 radiculopathy.
अरे यार ankle jerk का root value क्या है? छोड़ो, done.
It's wrong, so it is minus.
S1 radiculopathy, ankle jerk is absent.
Minus 10 for them. But you are still qualified to see the stem of the question 3.
Yes, sir.
Question 3 stem. 30-year-old lady on chemotherapy develops headache, vomiting and seizures. She was found to have sagittal sinus thrombosis. Which of the following medication is likely to be responsible? For plus 30,
play.
You would like to play?
Yes.
Okay, they would like to play.
L-asparginase,
Busulfan,
busulfan, chlorambucil, cetarbin.
Option D, citarabine.
No, I think it's wrong answer.
It's not the correct answer, so minus.
Audience, L-asparginase is the correct answer. Who said that? Diwan madam, आपको chocolate. Madam को chocolate देना please.
So minus 15, but still you are eligible to see the stem of the fourth question. Fourth question stem is 24-year postpartum woman presents with severe headache and impaired vision. There is a central scotoma in the right eye and there is a superior temporal quadrantopia in the left eye. What is the most likely diagnosis? For plus 40, play. Do you want to play?
Yes.
Yes, they want to play. Everyone wants to play all the questions.
Okay. Most likely diagnosis.
Is it a CVST? Is it a brainstem stroke? Is it a pituitary apoplexy or is it stroke in the posterior cerebral artery distribution? You got 15 seconds to answer.
So, stroke in posterior cerebral arteries.
I am afraid it's wrong answer. It's pituitary apoplexy. Postpartum है ना यार. You have to take the clue.
So minus 20 for this.
That ends our quiz.
That is the end of the quiz.
Listen. देखा तो सोचा ये this is a tough question but people have answered everything. Sinha sir, I'll come with you. We'll have one more question. All right. For time.
Fantastic organization.
Let's be here. Let's see the one more question.
ये कौन सा है अभी?
Hmm?
अच्छा.
So shall I proceed with the question?
I got it. Okay, so there is a tie for one of the positions. Okay, and that tie is between team A and team C. So you are going to get a tiebreaker question. And Brunmai, can
Only
you
one
please on the
question
buzzer?
or 4 questions? What do you want?
There will be, sir, I think you can just give them
One case, was there
one question with a buzzer.
Whoever gets it.
Whoever gets it gets
only
it.
one?
अगर वो wrong आया तो
Wrong है तो और एक दोनों का wrong आना चाहिए ना पर
जो it's like football जो पहला ये लाएगा
जो पहला करेक्ट करेगा सडन डेथ
No. See, what is the best question to give them? You think about of all the rounds. Is it the gamble round question? Is that the neck?
we can give them the gamble round whatever is
Okay,
remaining.
right then.
So okay, team A and team C, just check your buzzers first. Wait, reset, press. It is working, right? Put your hands on the buzzer. This is a tie for one position. I will not tell you which position. Okay. So which structure transfers
No, not
information-
this one.
Not this one.
I am going to give the question. Is it okay? Shall I start?
Yes, okay.
Are you
Team A,
ready?
Team C ready?
All ready? Okay.
Which of the following is not a synucleopathy? Answers are
Multiple system atrophy.
okay. One is pressed.
बोलो.
D.
That's correct answer.
And they get it.
You played well, but you.
10.
और अभी क्या सीन है? No, all the no. May I request Dr. Sinha to say a few words, Dr. Prajwal to say a few words, and Dr. Pujari. One of us, just say, address the students and say a few words. And you can join your friends. Thank you very much. Really played very well. Give a big hand.
We'll request everyone to please wait till the results of the quiz are over.
And
Please
there are
wait.
certificates to be given to all the participants.
All participants will receive the certificate, so all participants are also needed to wait.
Sir, bolo. Sir, it is not working? It's not working? Yeah.
It's a great pleasure to be here in this quiz.
Please wait. Please sit down here.
It's a great pleasure to be part of this quiz, and I'm honored to be here and very impressed with the performance of students and their interest in neurology. Very impressive that Dr. Gorthi has put so much of effort to take out beautiful quizzes. Dr. Gadkari and whole medicine department here has both combined doing so synergistic work. Very few places we find this kind of synergism between the neurologist and the medicine department. Very appreciable work. And that's why the students are learning, the MBBS students and these students are learning so much better neurology. This synergy is important. The core of medicine is internal medicine first. Unless a person is good internal medicine, good clinician, he cannot become a good neurologist. We are the basis. So I'm honored to be here, and all the students, I'm mightily impressed with your performance, the way you have broken the quiz. Thank you very much, all of you.
excellent organization by Medicine and Neurology Department, Professor Gorti, Professor Gadkari, and all those who have contributed. And fantastic questions, a mix of clinical scenarios, genetics, therapeutics, diagnostic, everything was there. Fantastic, really enjoyed. We all, as judges, I suppose, we also learned a lot through this, and hats off to the spirit of all the students, the participants, as well as all the students, being attentive all through the quiz. Hats off, excellent. I'm really proud of BJ, of Bharti.
Thank you.
So I'm really surprised at how much you all know. I mean, nothing like the kind of students we were during our MBBS. So wonderful event, sir, and mainly congratulate Dr. Gorti. I mean, this is one of the most fun and entertaining and interactive kind of learning experiences that you could have during your undergraduate years. So congratulations.
I thank all the judges. We are going to have the presentation ceremony very. Dr. Nitin, shall we start the presentation? So we'll start by giving the certificate of merit to 5th position. Come the list. Where is the list? Please give the list. 5th position. Team E, the 5th position. Sambhaji, where is Sambhaji? Come, thank you. Please, a certificate of merit and a small memento to Team E. Barsode madam, please come and do the honors for us. Come, Team E. Who is taking the photograph? I am. Yes. Very nice. Well played, well played. Thank you, madam. The 4th position. Symbiosis Medical College. Dr. Shilpa, I. Thank you very much, ma'am. Thank you very much. Dr. Sumit, may I request you to come and give the 3rd prize to?
Third prize was won by tiebreaker. So the tie was for the 3rd position between Team C and Team A. Team A answered it correctly and have won the 3rd position. Team A, please come.
Please come, Team A. Where are the Team A? Come, please. Traumatic encephalopathy has created problems. I request all the winners to be here. We'll have a photograph with all the judges and others. So don't go away. We have a professor of respiratory medicine here among us, Reader Ajay Kumar. May I request him to give the 2nd prize?
Second prize, any guesses which team? It is Team B.
Team B, please come forward. They are from BJ Medical College. Very nice. Cup, sir. Cup, sir. Sir. Very well done. Well done, well done. On the medals, sir. Medals. And it is the privilege of me and Dr. Nitin Gadkari and all the judges to come onto the stage and felicitate the winners. सर सर्टिफिकेट्स मेडल्स दे दिया मैंने May I request all the winners to come here? All team A, B, C, D, E. And hold your mementos with you so that we can all have a photograph. May I request Barsade Madam and medicine faculty to join us? Dr. Sumit, Dr. Pranav, Dr. Neha. Where is Dr. Neha? Ask her to come, no? Right. Call Neha. Where is Neha? Some teams can come here in the front. You can squat if you want with cups. Come on, join. No. Upload, join karo. Sign group, join. Sign group, join. Sign group, join. Squat. Where is Dr. Chaitra, the MC?
I think your friends are asking
Come.
you to lift up the cups.
Come.
Lift it up.
Aajao. Yes. Children, thank you very much. You made our day today with lot of enthusiasm and participation. Make who is the number third prize? Third prize money, please. Who is the third prize? Which team? That's a prize for you. Right. Prize 2. This is the cash money for you. Prize. First prize, cash money for you. Okay.
Everyone is please requested to join for the high tea and snacks which are outside. Please don't go. Yeah, and all the participants please remain seated. We will give you all the participation certificates and the medals. Rest all can join us for the high tea and snacks.
All the participants, please sit down. Your college will be called. Please come here, collect your certificate and medal, and then proceed for high tea. We'll start.